Good evening, everyone. It's going to take a moment for everybody to get connected here as Zoom catches up to all the participants. So we're going to wait a second. If you want to take this as a chance to send a little kudos to somebody, it'd be a great time to do it. And we'll start in a couple minutes. If you're just joining us, we're waiting for Zoom to catch up with all the people who are trying to connect, and then we'll get started in a couple minutes. All right, it looks like the count's starting to stabilize a little, so hopefully most people have connected, and I'm sure we'll get some more as we go. So let's go ahead. Next slide there, Maggie. So I want to just welcome all of you to another CSD Town Hall. I'm really pleased to see that so many people have been able to join us, and I hope you were able to take a moment to send some kudos. Remember, that's always available, so please don't hesitate to do that. It's really important at a time like this that we share that positive feedback when we can. We've had a series of town halls. This is our 9th since the beginning of August. If you're interested in any of those topics, all of the recordings are available at csdecatur.net/opening2020, and there'll also be a recording of this town hall there once that finishes. So next, we're going to hear some thoughts from our Teacher Advisory Council representatives, And I just want to share that I appreciate that they accepted my invitation to facilitate this town hall. And I can tell you they've been working very hard to represent all of you to the best of their abilities. So Teacher Advisory Council, why don't you take it away?
Thank you, Dr. Duty. Teachers, staff, thank you guys for your trust in us. Thank you for asking the difficult questions countless numbers of times over the past 2 weeks. We've given Dr. Duty a copy of the questions in entirety with all names withheld. We don't know if they'll all be answered, but we hope solutions will be put into place and your voices heard.
We are choosing to open the town hall by asking the Teacher Advisory Council members restorative practice questions and giving a response, as if we are answering for the teachers we represent. Traditionally, responses to restorative practice questions are offered using an I statement, but because we collaborated as a TAC group for our colleagues, we will respond with we. There have been numerous reactions to your announcement about school return, and we would like all of our voices to be heard.
What happened?
Our superintendent announced return to work orders.
What were you thinking at the time? What did you think when you realized this was happening?
Shock. This plan was never one of our 4 options that was presented in the quadrant model. You stated at a September 8th board meeting that you believe we would stay virtual through December. At the TAC meeting on Tuesday the 15th, you heard from us that many of our staff was not ready to go back. You stated that without teachers who are ready, the return simply does not work. You said you wanted time to return in a way that the majority of teachers are ready to come back and feel confident that informed decisions are being made and proper precautions are being taken for safety. We don't see how the data matches the decision. We don't see how the survey results match this decision.
What have you thought since then? What impact has this had on you and others?
The TAC team has heard from hundreds of colleagues, and they have sent in hundreds of questions that we need responses for. Many staff members feel blindsided by this decision and have lost trust in our district's leadership. They believe that our school system cannot safely support full in-person learning at this time and believe that the data was misused to support a reopening plan. We are scared. Many of us cannot afford to resign.
What do you think needs to happen to make this right?
We think we need to hit pause until the plan is more thoroughly vetted, staff is more confident in safety precautions, and data supports a safe return. We think more people need to be at the decision-making table. We think Little Decatur can make a big statement in how we handle education in a pandemic. We do so with everyone's health and safety in mind first, and service to our students next. We can pivot, we can innovate, we can help families who need it most. We don't all have to create a greater risk by flooding buildings with people. We can find people able and willing to do the in-person work. We'll do it in a smart way that treats everyone's health and safety equally.
We, the Teacher Advisory Council, based on the collective feedback from the teachers at our school, would like you to reconsider the overall time frame of the plan that you suggested. We have received many questions from teachers across the district, and the questions selected tonight represents them as best as possible. The first question: will you allow teachers to keep working from home until the teacher workdays before the return of students?
Sorry about that. I forgot I was on mute. Thank you all for your opening statements as well, and let's get into the answers. So the process for employee accommodations will come up in some future questions, and it applies to the time period starting October 12th, just like it does the period starting November 2nd. So I'll get into that in a little bit more detail then. Because it's already safe for the vast majority of our employees to return to work on site, I felt it was important to bring all employees back simultaneously. If we didn't do that, then we'd have some teachers like those in the early childhood and adapted curriculum special education program working in person while other staff were not, and that didn't seem fair to me. Additionally, teachers working on site while their students remain virtual many of them would be largely alone in their classrooms. So if our employees feel it's important to not return simultaneously and are comfortable with some people having options not available to others, then I can certainly revisit that decision. So I'll explore this further so I can better understand the overall preferences of our staff and if that's the direction we want to go.
Our next question is about teachers who are also parents. Which of the following 4 options can teachers that are parents expect to experience? A safe supervised learning pod space free of charge for their kids at their school they work. B, they can work from home until their kids have to return or they have to return to the classroom. C, their children can come to work with them and be in their classroom. Or D, all of the above will be options.
So thank you for that question, Sarah. We intentionally designed the CSD facilitated learning pods so they would coincide with the in-person start date for employees, because we know that supervision of children is as big of an issue for our employees as it is for our community members. So since these pods are funded by taxpayer dollars, we will be providing them to CSD students free of charge. We're also planning to have additional space available to accommodate non-CSD children of our CSD employee who may need childcare, and we're going to do that at a very small fee. We are seeking to have that fee only cover the incremental costs of the additional student, so we are aiming to keep it under $20 per week.
The next question is also in regards to teacher parents, specifically aftercare. So finding aftercare on this notice is near impossible. So what are our options for after school care? Can they be bused to our school like before? Or can we have flexibility to leave and go get them and return?
Thanks, Kimberly. So we're planning to have the CSD learning pods open from 7:30 to 5 each day. We're still working out some of the logistics, but that's our goal, to have them open so that won't be an issue for staff depending on what their schedule is. If people are using other arrangements for childcare, obviously they're going to have to determine what those arrangements look like. But the pods we are planning to have open from 7:30 to 5 to accommodate them.
Dr. Duty, can I follow up on that
Yep.
question real quick?
Yep.
If one of our children goes back into the classroom in November, I think this question's more for that. Like, what happens after at 2:30 when they get out of school, but the parents are still working?
Oh, okay. Thank you. I misunderstood that. So I'll have to look into what our options are there. We do anticipate that the learning pods will fluctuate a little bit so that we have some space that opens up as people pick up their children after school. So that may be an option. Thank you for clarifying, Kevin. I'll have to explore that a little further.
So next we have choice for teachers. There is an option for parents and families to choose between virtual or in-person learning. The only options for teachers and staff, especially those of us who are high risk, are either resigning or going back in person and gambling with the possibility of contracting COVID-19 and facing irreversible damage to our immune systems or potential death. Will you give teachers this option as well?
So I'd be remiss if I didn't point out the choice of language in this question as an example of the challenges we're all facing in our understanding of this environment. Words like gambling and irreversible damage and potential death kind of underlie the fear that I've discussed in some of my previous communications with staff. So I know there's a lot of fear about returning, and I also know that the current trends in our community's health data tell us it's safe to begin planning this return. So if the data we're monitoring change in such a way that it's not safe to return or remain in school, then we'll alter our plans accordingly. That's what we've been saying all along. Giving parents an option and giving teachers an option are two very different situations. We're funded by taxpayers to provide a service, and a significant proportion of those taxpayers want the option to send their children in person. Teachers are employees who are paid to deliver that service, so we need those employees on site to deliver the services those parents are seeking. We do have teachers and other staff with specific medical conditions that require additional accommodation. And that's why we have the process through staff support to request those accommodations. And additionally, school leaders are empowered to come up with solutions that can be implemented within their school ecosystem. And so this is something we're well aware of as being an issue. And while we don't have the specifics everybody is seeking, it is something that we're working on, and it is something that the school leaders are working on very hard to see if within their environment they can accommodate some of those needs as well.
Dr. Duty, you reference safe data. What is the safe data?
Well, we'll get to that in the future. There's a question about that coming up.
Renfro alone has reported over 50% of teachers that are considering not being able to come back to work under the plan that you outlined. Can we offer a tiered level of teacher needs that identify the most at risk to lowest risk and provide an online opportunity to teach for those most at risk? This action could potentially allow for consistency of delivery between virtual and in-person models.
Thanks for the question, Susie. There's a lot of overlap with the question before it, so I won't reiterate some of those. But I will say that in terms of the coming up with that plan, there are a lot of options that are coming out of our school planning right now. But I will point out one other thing. In the same survey that you referenced there, the Renfro teachers were asked what level of community transmission would allow you to be comfortable with returning to in-school classes. And 91.7% of the teachers selected they'd be comfortable returning if the rate was below 5%. And the other 8.3% said they'd be comfortable if the rate was below 10%. And so I have some good news. The rate has been below 5% since September 5th, and it's currently under 3.5%. And so that's some of the data that we're looking at, and I'll get into the data a little bit more in one of the future questions.
So the next two questions are about substitute teachers. Has the substitute pool been surveyed regarding their willingness to work face-to-face? And what measures will be put in place to protect them and us from possible spread between buildings?
Thanks, Catherine. So yes, we have been in communication with our substitute teachers several times over the last couple months. We're going to be implementing the same mitigation strategies for them as we are with all of our employees. Substitute teachers will not be moving between buildings on the same day and will largely be assigned to a single building to the greatest extent possible. So we're working through some of those details, but we recognize that as much as possible, we need to keep people in one place. And so we believe we can do that with the vast majority of our substitute assignments.
If a substitute is not available, will teachers need to cover those classes? And will central office staff station themselves at schools to be potential substitutes to help with class coverage, support with transitions?
All right, thanks, Susie. So obviously when teachers are absent, it impacts everybody. Our entire educational system is designed around teachers supervising and instructing students in the classrooms. So we do our best to ensure there are sufficient substitute teachers available, but when absences are excessive, that's sometimes not possible. So in those situations, we will continue covering those supervision needs with all the available staff. Each school has different approaches to how they do this. So the specifics for your school, you'll want to discuss internally with your principal. But if Wilson Center staff can be of service, of course, I'm confident they will step in to help as they have in the past when some of these situations have come up.
Dr. Duty, one more question about the substitutes. I know that a shortage of substitutes has been an issue for schools across the district for some time now. You said you surveyed the substitutes and they are willing to come back, but has the substitute pool increased in number?
So I don't know off the top of my head if it's increased in number, but we do have a lot of substitutes who are looking to come back. Like many of us, they need the money to come back. We have been employing some of them in various roles already. You may recall that we had our substitute pool back when we closed in March. We reached out to them to try to figure out how they could serve as mentors for students and things like that. So I would anticipate at a minimum having about the same number of substitutes, but you're right, it is always a challenge to have enough substitutes no matter the environment. So it is something we're continuing to seek out more substitutes. That's what I know off the top of my head, Sarah.
May students in the REP and all MTSS or RTI or other special populations who aren't being successful, can those students return before their dedicated grade level?
So thanks, Kevin. Good question. I asked our MTS coordinators when I first saw this and learned they are not aware of any such requests. So the first step would be to discuss it with them. But this is a great example of why we have the proposal process that many of you heard me speak about. That if an employee, if the employee who submitted this question, for instance, has an idea for how to do this successfully, then he or she can work with the school principal and create a proposal that outlines what that plan looks like. And then our district COVID team looks through those proposals and works with the person that submitted it to try to ensure all appropriate safety measures are incorporated, and if at all possible, put it in place. And so I don't know exactly what they're picturing that this would look like, but this is a great example of why we put that process in place, because we have a lot of very creative people who can come up with ways to do this. And so we wanted to give them a way to do that.
Teachers are requesting Wellness Wednesday continue upon student return. Virtual schedule varies slightly than in-person schedule. Will schedules be the same or change when all students are back in the building, like start times and end times?
So schedules may be changing based on the different requirements of in-person learning, and I'll give you an example. It's likely that schools with multiple class periods, like the high school and the middle school, they may need to develop some alternative schedules that maximize cohorting and minimize transitions. In other instances, the schedule may be able to remain relatively consistent to what they are now. So it's a little bit difficult to answer in general in terms of start and end times. We are going to try to go with the start and end times that we will do for the rest of the year. They may not exactly match the start and end times that we have right now, because the start and end times are based on bus schedules and things like that. So they'll be very similar to what you've seen in the past, not necessarily what we've been doing during the virtual period. But the schedules during the day are really a school level question. And so I encourage you to check with your school COVID team or your principal to figure out exactly what that's looking like at the school level.
Do we have a contact tracing protocol that is transparent, accessible by all, and effective, and a clear plan for informing our community our COVID cases?
Thanks, Eileen. So yes, we do have CSD nurses have completed contact tracing training. Our staff support staff have completed some contact tracing training. So the nurses will lead the contact tracing for students, and the staff support department will lead it for staff members. So if we have a person with a probable or confirmed case of COVID-19, we will be contacting them to figure out where they were, using whatever resources we can to figure out who they are in contact with. And then we consult with the Department of Public Health, and our lead nurse for students and our staff support for employees will then notify any of those individuals who were possibly exposed, along with any requirements that go along with that for isolation or quarantine or how they return to school or work, things like that. We will also notify the applicable school community of any cases among students or staff. We know that's a big issue. Some school districts are not as upfront about the cases as they have them. We do plan to notify if there is a case in a given school, where we will notify the whole community within that school. So we're finalizing the written procedures of this for contact tracing, and we'll be sharing those on the website. So anyone who wants to take a look at review those, they can. And then we will also be posting information on cases and quarantines associated with our schools. So those interested in following that will be able to find that information as well. So we are going to be as transparent as we possibly can with any cases that we end up having within our district, and notifying all those that might be impacted by it.
All right, so our next couple of questions are about concurrent teaching. So in some of your communications, you mentioned that there are best practices for concurrent teaching that some other districts are using, and that will be shared. We know that the virtual team had time over the summer to work on a detailed plan. Did the team have time to work on concurrent planning before the announcement? And who is doing the planning now on that team?
So we have a team of teachers and school and district leaders, including some members from that summer Vanguard team that you mentioned, Sarah, and some members that have the new online teaching endorsement, for instance. And as a team, they're reviewing the information, they're speaking with other districts that are providing concurrent instruction. They are already working diligently, and they're making some really great progress. So much like the team did over the summer, they are preparing strategies and guidance and recommending tools to support success of this model. And then I've got a couple more thoughts to share about concurrent teaching, but the next question has some similar overlap, so I'll save some of those comments for that one.
Dr. Duty, can I interrupt real quick?
Yes.
Can we go back to the Wellness Wednesday request from a minute ago? Is that something that will be possible to continue?
So we are looking at what we can do for wellness activities. I don't know if it will look the same once we go in person, because we do have to figure out supervision. Whereas when we're 100% virtual, the Wellness Wednesday doesn't have the same supervision requirements. So it is something we're talking about, but I can't tell you exactly what it's going to look like once we return to in person at this point.
The concurrent teaching model has different issues at each grade band, but in the end, it is more work as teachers will have to plan for virtual engagement, in-class materials, virtual materials, in-class assessments, virtual assessments, etc. While the plans might overlap, there are certainly different considerations. In addition, because we will be teaching most of the day, the planning time will be much more limited than what it is now. How are you going to provide teachers with the time they need to be effective with this model? Is there a possibility that teachers can have one day a week to plan and prepare?
Thanks, Sarah. So there's no doubt that this current pandemic has increased the workload for everyone, right? And unfortunately, that's not likely to change in the future. Based on the work that I've seen from that planning team I was speaking about with the last question, and knowing so many of our teachers, I am confident we'll come up with some good solutions to all of those challenges. And I have to share that what I'm hearing now about the concerns with the teaching model really echoes what I heard from many teachers when we started talking about having to go to the virtual model. And, you know, we persevered, we showed everyone what we can do. You all are amazing educators, and we came up with some really great stuff. A lot of it came out of that virtual Vanguard team, for instance, and I anticipate we'll have similar things coming out of the team that's working right now. While the specific challenge is a little bit different, I'm very confident that we will figure out how to work through this and make things work. Additionally, though, individual schools, they may develop other approaches that work for a particular subject or a particular department or grade level, et cetera. And so they are empowered to implement those changes as they see fit. The principals have been coming to us with ideas of, hey, we've got this unique situation. What if we approached it this way? And then we don't have to do the concurrent teaching. And they are empowered to do that. And so I have a lot of faith in our teachers and in our administrators to come up with some really good solutions. And if concurrent teaching isn't the right solution for a specific circumstance, I'm okay with them going a different direction that still serves the needs of the students.
Can we circle back to having additional time to plan and prepare? Because I do think that is a big difference between how we tackled virtual learning and how we're being expected to tackle this new model.
No, good question, Sarah. So one thing that hasn't really come up, but I know people appreciate it. We have built in 3 full days of planning so that in anticipation of it, I know this isn't necessarily the planning you're talking about, but that's significant, right? Most teachers who have had to transition to this in other districts have not had 3 entire days of planning. So I'm pleased that we've figured out a way to do that. But in terms of the day-to-day planning time, it is something that we're talking about with that team that I spoke of earlier to try to figure out are there creative ways to create more planning time. So I don't have an answer for you yet specifically to exactly how much your planning time will look similar to what you've had in the past, but I absolutely understand the concern that planning time looking similar to what you've had in the past in a time when it's incredibly more work to do. I get it, right? I understand what it is you're seeking. And so we are trying to see if we can find solutions to that.
Social distancing. Will there be a cap on the number of students who return in each classroom? This is particularly concerning at ECLC, which may reach full capacity on November 2nd. If not, social distancing is an impossibility, so how will we keep our students and ourselves safe? There are concerns about social distancing and they vary across the grade bands.
Thanks, Meredith. So one thing I can't help but reflect on one thing with this question, which is with the supposition that ECLC is at full capacity on November 2nd, what that means to me then is that all of the parents felt comfortable sending their young children to school. And so that would seem to indicate to me that they believe their children will be safe. But so the CDC has consistently recommended social distancing to the greatest extent possible throughout this pandemic. It's one of the things that has not changed since the beginning in the recommendations. And while social distancing is important, mandatory masks are much more important. All of the experts we speak with emphasize that masks are very important. So the recommendation to maintain 6 feet is more about recognizing the benefits of spreading people out than it is about the risk inherent with, say, 71 inches versus 72 inches. So schools are working with their local COVID teams to make specific accommodations needed at their grain band so they can implement social distancing to the greatest extent possible. And that is something that they are working on right now and will continue working on. And so we do intend to do everything we can to stay as close to the social distancing recommendations or over. But I just want to emphasize that this is not something where if we can only maintain, 5.5 feet, not 6 feet, that doesn't necessarily mean that that is not a viable solution. If we can't maintain anything close to that, it probably does mean that it's not a viable solution. So it does vary considerably depending on the facilities. As you know, we have very different sizes of classrooms. We have very different schools with different additional spaces available. And so it really is something that the local COVID-19 teams are working to try to figure out what that would look like.
Dr. Judy, a follow-up. So if the classrooms vary across from school to school, can schools implement a student cap per classroom and the number of students that can be in a class?
Yeah, so the schools will need to look at specific classrooms, Sarah, to figure out what is safe to accommodate within that classroom. So that's why we're not setting a specific number. We have everything from like 500 square foot classrooms to 800 square foot classrooms. And so what you can accommodate safely in those spaces is very different. And so that definitely is something that the schools are looking at. We're providing guidance about how to figure out what you can fit. Some of it depends on what kind of furniture you have available, what kind of safety mechanisms you have available to divide up spaces, things like that. So the local teams are working on that.
The next few questions deal with cleanliness. Many of our custodial staff of color are in high risk age category. Our African American community is contracting and dying from COVID-19 twice the rate of our Caucasian community. How can we guarantee the safety of our custodial staff while also expecting the highest cleanliness standards required to keep all staff and students safe?
Thanks, Kimberly. I appreciate that this question implies that people are thinking about our custodial staff, because I do feel that too often that doesn't occur. Our custodial team has been working in person throughout this pandemic. And it didn't appear to me that very many people were worried about that until it came time for them to return to work. So I appreciate that this is becoming a question and something people are thinking about. Our custodians can request accommodations just like any employee can. They've received training and they have more scheduled in the coming days at how to remain safe personally, and also how to safely and properly clean our buildings. And I think there's another question coming up that talks about concerns about race. And so I'll share some additional thoughts on that one.
Substitute custodial staffing has never been a reliable option, as each school is often understaffed if a custodian must be out. Who will clean the schools if the custodial department is understaffed?
Thanks, Susie. So staffing custodial positions is always a challenge, and it's not likely to change. However, the operations department has been working really hard to identify substitute custodians. And I've also authorized them to use overtime if needed to ensure we're meeting our cleanliness standards. So I am confident they have a good plan of how to maintain the standards that we need. It may involve some overtime work if we start to lose some employees that we can't backfill or don't have substitutes. But we have a really great team of custodians, and overall they're doing a fantastic job, and we're going to keep supporting them in doing that. So I do believe we'll be able to maintain our standards even if we have some struggles with finding substitute custodians.
Are teachers responsible for cleaning his or her classroom?
Thanks, Eileen. So teachers are no more responsible for cleaning their classrooms than they have been in the past. They'll still need to, stack chairs, keep surfaces free of clutter, make sure students are getting trash into the trash can and things like that. We have gathered a lot of cleaning supplies that will be available to teachers. So we know some teachers really like to clean and they want to have the wipes available or some other cleaning supply to clean their room because it helps them. And those will be available to the teachers, but it isn't an expectation that they have to do that cleaning. The custodians will be doing the cleaning.
Dr. Duty, can I ask a follow-up to that?
Yep.
So at schools where class changes happen, what will happen in between classes?
Well, so we have really encouraged schools like the middle school and high school to try to figure out how to absolutely limit class changes as much as possible on a given day so that there is time to figure out how to get those rooms cleaned in between. So I've asked them to get pretty creative. It helps with the cohorting and it also helps with the cleaning. So I do not know yet, Kevin, what the answer to that is because I'm waiting to hear back from the schools on what kind of plans they're putting in place. But they kind of go hand in hand, the cohorting of keeping kids together in the classes and the cleaning of the classrooms and the frequency we can do that. We want to limit both of the transitions and the cohort, and we want to keep the cohort so that we can limit the transmission as much as possible.
Okay, the next few questions have to do with illness. Will the district provide opportunities to get tested for teachers and staff? If yes, how frequently? If no, will you reconsider?
So the experts that we're consulting with currently recommend against mandatory testing, but it is an ongoing topic of discussion. So we will continue having those conversations. Employees who wish to get a test, of course, can utilize one of the many free testing sites, or they can probably get a test through their doctor, depending on what medical plan that they're on, whether there would be a cost or not. So it's absolutely critical, though, that everyone who gets a flu vaccine this year, that's probably the most important thing that we can encourage. And so we are exploring options to, again, offer flu vaccine clinics at our school sites. So look for more information on that in the future. So at this point, we would not be requiring testing based on the advice of the experts, but it is something that we review on a regular basis. I did hear just the other day, I'll just share anecdotally about these rapid tests that are coming out that give results very quickly, and they actually can test for multiple things. I think 2 strains of flu and COVID-19. I'm really intrigued by that. I heard they may be somewhat limited, so I don't know what that's going to look like. But I also heard that they're going to emphasize places like schools was one of the things that they thought they'd emphasize use of those tests. So to be determined, we'll see where that goes. But as of this time, we would not be requiring testing.
It sounds like the answer to this might be about school teams, but many teachers, including specials, the majority of high school and middle school teachers, intervention and special ed teachers, links teachers, and then staff who are split between schools are exposed to many more students than a classroom teacher would be. What is being done to ensure that those teachers don't become super spreaders, given the number of children that we see in a week?
Yeah, you're spot on, Sarah. Each school is working out the specifics of how they're going to handle specials or whatever they call it at their school. So for example, some schools I've heard are thinking about having specials and other support program services provide their instruction virtually from their classrooms. So basically virtually from one classroom to another, or taking students outside, depending on what the special is. And so you are correct. The schools are exploring the options that they have available to them to try to figure out what that looks like scheduling wise.
I think you touched on this when you were talking about contact tracing, but just to be clear, how will people be notified if there is a potential case of COVID that we have been exposed to?
Yeah, you're right. I did, I think, Catherine, but it's worth repeating. So if someone has been exposed to a positive or presumed COVID case, you will be notified. We'll call you, we'll email you to let you know of that exposure, as well as what to do next. And so I think there were some concerns earlier in the summer about what is our process. Does it matter if people are in the building or not? We've received a lot more guidance from Department of Public Health. I'm very confident in our process. And like I said earlier, we'll be posting on the website so you can be confident in it as well. So, but if you are exposed, we will be contacting you.
Dr. Duty, if a teacher is quarantined, do they go on and continue teaching virtually?
It's a great question, Susie, and it's something we're still trying to figure out. What some school districts have done is, yes, the teacher goes virtually, and then you bring in a substitute to supervise the kids in the classroom. And so they kind of flip-flop, and the teacher stays virtual while they're quarantined. That is assuming, of course, that the teacher is able to keep teaching, right? If they're very sick and they're not able to keep teaching, then we would have to bring in a substitute, just like you would any other time someone's sick. So the details are to be determined, and that kind of depends on the case and what the condition of the teacher is. If they're needing to quarantine because of exposure, or are they quarantining because they actually are positive, and what their condition is.
And this goes back to that substitute question I had asked. I asked if a substitute isn't available, then will teachers need to cover those classes? And you say staff, what does that mean?
I'm not sure what you mean. Sorry, Susan, or Susie. You mean when I said that staff might have to step in?
Correct.
Yeah. So I think that we are all on the same team, right? And so I know at Renfro, for instance, that we have administrators will step in and cover classes. I also know teachers have had to cover a lot of classes. And so as long as you are somebody who is a functioning adult who could come in and help supervise those kids, whether it be in the building, or I know we have a lot of people at Wilson Center who are ready to step up and help as well. That's what I mean by staff, is that we've got employees who, when we need supervision, there are a lot of different people who can step in and help. Where it's a little different is like that case that I was talking about a minute ago, where a teacher is out sick and will not be able to teach at all, even virtually. So it really comes to teaching, not supervision. So if you need someone who can actually be teaching the content, we may look at that a little differently in terms of who's appropriate to step in, because they will actually be covering content.
How was racial equity taken into consideration when Black and Latinx people have alarmingly higher rates of life-threatening COVID, and you're requiring Black and Latinx workers to return to work in person?
Good question, Kevin. So like I mentioned previously, I'm really glad to see people are following our Courageous Conversation protocol to isolate race. And I just really hope people will continue doing that. It feels sometimes like people only bring it up when it serves them. But when it doesn't serve you personally, to isolate race is probably one of the most important times to do it. So we would not require any employee to return to work if it isn't safe for them to do so. And so the disproportionate impact on people of color, it's yet another reminder of the systemic racism that continues to impact our students and our staff and our community to this day. And just like any of our employees, our employees of color would also be eligible for all of the same accommodations that we're providing to any employee. So it is something we look at on a regular basis. The data that we access, much of it can be disaggregated by age, and it can be disaggregated by race, and that is something that we look at. So if I didn't feel it was safe for them to return based on the totality of the data, I wouldn't have been bringing anybody back. So that's my feeling on that. Someone want to do this one, or you want me to just jump in?
I can go ahead and read it. I think Eileen is with her.
I have it. I'm ready.
Okay, she's ready.
Oh,
sorry.
In the county that has recently been taken down from CSD's website does not support a safe reopening. Why are we not following DeKalb County's metrics for a return date? You referenced the CDC indicators and thresholds. I've not heard you say what the threshold level of risk you are comfortable with in determining the reopening, nor the specific number of indicators you are considering, i.e. core indicators and 3 of 5 secondary indicators. Can you specify the indicators and the thresholds you are using to make your decision? What date would change to these thresholds? What date would change to these thresholds determine a change to the reopening plan?
Thanks, Eileen. I appreciate those questions. I think that last one must mean what data would change, and I'm gonna interpret that as yes. Meaning that. So so rather to get into, I'm not going to get into the details about the CDC indicators and thresholds, because I'm working on a series of videos that explain those that go along with the dashboard and each of those associated graphs. So I won't take too much time going into that, but let me hit on a couple things. One thing is I disagree that the data do not support a safe reopening. The CDC metric for cases is an extremely strict metric, and it goes far beyond what surrounding districts are using. So for instance, in DeKalb County, they're using a level of 100 cases as their bellwether, and we're passing that benchmark right now. We're going below 100. In Fulton County and other local counties, they're using even higher, less restrictive thresholds, like 150 cases or 14 days of decline. So it's interesting to note that our moving average of cases in DeKalb County has been declining consistently since early July. So for months, we've heard the standard that we need to see is positive tests fall below 5%. Well, we fell below 5% at the start of this month, and we're currently below 3.5%. Our metric on inpatient bed use is in the low risk category. The metric on ICU bed use is in the low risk category. The metric on hospital beds that are used by COVID patients is in the low risk category. The only indicator that appears high is the number of cases. And as I've said previously, the standard used in that metric is extremely strict, and it's much more so than what our surrounding counties are using. So as you'll see in the dashboard, I've created a section where we can consider weighting these core and secondary indicators in order to provide an objective measure that so many people are seeking. I understand the desire for that. So our work on that continues. And if we're able to come to agreement on an objective approach, I'll be sure that we share that. So take a look at the dashboard. It's there. We improved it based on the feedback from when it was first released. And what I'm talking about in terms of weighting objectives, you can go to the 3rd page of the dashboard and you can try it out and see what does weighting the different dashboard or what does weighting the different indicators do to the overall weight of what it looks like. So that's the purpose of having that there, is to see if there is a way that we can come up with an objective measure. I don't know if we can, but I also understand the desire for it, because it would be nice to be able to say, if A, then B. And right now we can't do that. So that's where we are with the data.
Was the non-teaching staff of CSD, the custodial staff, cafeteria staff, nurses, office staff, asked for their feedback and concerns about returning to school?
Thanks, Holly. So all employees were given the same opportunity to provide feedback. So I don't have much more to say than that, I guess.
It's our understanding that the October 13th board meeting is planned as a virtual meeting. When will the board meetings begin to happen in person? And will there be a cap on the number of community members who are allowed to attend in person?
Thanks, Sarah. So the October 13th board meeting has not yet been planned. I don't know if the board is going to choose to meet in person or not on October 13th, but like I shared previously, I'm going to recommend that all of our various governance groups hold their meetings in person when we're hosting students in person. So, excuse me, when the board returns to in-person meetings, and that may be October 13th, it may be after, I don't know. We are going to maintain that virtual presence that we can use to accommodate our stakeholders who can't attend in person, or for whom the size of the room that cannot safely accommodate, just like we're talking about with the classrooms earlier. So, and I'd anticipate that our school leadership teams and other governance groups will be doing the same. So, but I don't know if the board is going to say, hey, let's meet in the gymnasium so we can have as many people there as possible, or if they're going to say, hey, let's meet in the boardroom, have a certain number of people based on social distancing that we can fit, and then the rest of the people come virtually. I'm not exactly sure what that's going to look like. They still have to decide that. But I will be recommending what I just shared. All right, I know you guys have some closing thoughts, so you guys want to share those?
Are there any questions that the TAC still had? Was there any other questions that weren't answered?
Susie, I know we have the questions that we were hoping to get to if we had time, and I do think we still have time if we want to move into those questions. Dr. Duty, these questions were the ones under the table that we also shared with you.
Okay.
The first one, can you tell us more about details of the proposed pods, like how many kids are going to be there, who's going to facilitate it, and like what location they're going to be at?
I can tell you in general, we have 2 administrators working on all those plans right now. It is going to depend on the facilities. So we're working with the city to see what city facilities are available. Our city manager was very, what's the word I'm looking for? very willing to work with us to help provide some city facilities where possible, if we can do so within whatever requirements the city has. So we're looking into those possibilities. We're looking at possibilities in our schools. We're trying to focus on spaces in schools that the pods could continue even when the students start transitioning back. We want to do as little transition of pods as possible. So it will depend on the individual facilities of how many can safely be accommodated within any given room. We're planning to try to have them all over the district so that community members can access them as close as possible, but also so staff can access pods that are nearby their workplaces. The pods in general are going to be all supervised, of course, and so we're working on exactly who will be supervising what. We have some leads on some folks who are able to step in, who have experience supervising kids, who will, we're hoping can help supervise those pods, so we're working on that as well. So some of the details are yet to be worked out. We've got the two folks working on all the nitty-gritty details of the pods, how you'll sign up, what the procedures will be, what things will look like during the day in the pods, as well as figuring out what happens as we start transitioning back and some grades start going back in person. Presumably the pods might get smaller at that point, and so we're already thinking about, might we have to look at combining pods as we start transitioning back in person. So not all the details are worked out yet, but they will be very soon. Did that answer your question, Kevin?
Yes, sir. Thank you.
Okay.
Can we consider, we've asked this in a few different ways. We're very concerned about teachers that cannot be in the classroom. So can we consider having positions for virtual support teachers that support more than one on-site teacher? These positions could be reserved for those who are or live with someone who is medically fragile. They can assist with virtual lessons, online small groups. We can protect an important population of our CSD staff and reduce their risk.
So Susie, I'd say yes. And to me, it seems to, if I remember the question correctly, seems to fall very much in what I was talking about earlier of the schools being able to figure out some unique solutions for their exact environment. And so I don't remember all the details of what you said, but from what I did hear, it sounds to me like it would fit very well within what schools may be able to do.
Is there a plan for student bathroom use in all of the buildings to avoid too much student contact and exposure to aerosol particles?
Yeah, good question, Catherine. So again, unfortunately, the bathrooms are very different in different buildings, right? We have everything from group bathrooms in some locations, and we have things like at Talley Street, for instance, we have the new very individualized bathrooms that are like their own little rooms. So each school is developing their own protocol. It's one of the reasons we have our COVID teams at the school level. We've given them some guidance of things to think about, and then they'll figure out the specifics of what it looks like in a given school.
Where will the students eat lunch?
Good question, Holly. So I hate to keep saying this, but it is going to vary because each site is a little different. So I'll give you some examples. Some of the cool schools I've spoken with who have successfully returned have come up with plans where they may have a very small group of kids in the cafeteria. They may have other spaces in the building that they can utilize, that they have kids assigned to. The one thing I've heard over and over again is the advantage of assigning kids to specific spaces so that it's not left up to chance. I know at elementary that we would always do that, but even some of the secondary schools I talk to have been very, very much fans of assigning kids to specific spaces because you just really need to know where kids are. The other advantage is in the chance that you do have some kind of an infection and you have to do contact tracing, you know who was where and when they were there. And so it is going to depend on the schools. Some schools it's going to be easier than others to figure out depending on what kind of space you have available. But those are some of the solutions that I've been hearing about, but each of those teams is working on that.
One of the mitigation strategies is social distancing to the extent possible. And I'm going to add on to this question based on what you said earlier, in that it sounds like we're relying pretty heavily on masks. But I wonder how much of a mitigation strategy that can be when you're asking kindergartners and even high schoolers to wear masks correctly for that to be an effective strategy.
Yeah, so good question, Sarah. So the masks, obviously there are challenges with getting people to wear masks. I think it is very different at an elementary level than at a high school level. As I've shared before, the masks are going to be part of our dress code, and they'll be handled as dress code. And so they'll also be handled age appropriately. And remember, we're using our PBIS framework, and so we'll be approaching masks the same way. If somebody is just wantonly disrespectful and saying, I am not going to wear this mask, you can't make me wear this mask, et cetera, and they're a 16-year-old at the high school, the administrative team may deal with that differently than a kindergartner who keeps forgetting to pull the mask up or something like that, right? So just like we do with any of our behavior management with students, we'll do the same with masks. And I do know that many schools have been very successful in getting the students to wear masks. I do think it's important that we require masks and not make them optional, and that's why we are adding it as part of our dress code. And there are going to be some challenges with some kids. I think the vast majority, it won't be an issue, but we will address those where it is an issue. And so we're not going to let kids, for instance, and I guess I'm picturing mostly middle school and high school who may just really try to stretch the limits and just really push it of not wearing masks. We're not going to have a huge tolerance for that because it is so important that everybody will be wearing the mask. And so they may be sent out of the in-person environment and have to participate virtually for a given period of time. So there's something we're working with the administrative teams on to develop kind of what does that look like at different age groups, and what are the responses depending on if it is more of an innocent mistake versus a wanton disregard for the rules.
Can I ask a follow-up question, Dr. Duty?
Please do.
So let's say that our school determines a specific cap for a number of students in a classroom, and then it turns out that more students are returning to that class than expected. What would happen at that point?
I think it depends on where we are in the process. It's a good question, Kevin. So one of the things we're doing is constantly watching the data, right? So if that happens in the first week, we may react differently than if that happens in January or something like that, depending on what the data say and what kind of risk we're looking at. So it is one of the things that principals are having to consider. What kind of capacity do they have as the numbers change? One of the things we're doing to help them plan is we're going to be asking parents in the coming days to make a selection of, with what they know right now, do they anticipate sending their kid in person, or do they anticipate sending their child virtually? And we're asking that now because we have kind of a chicken egg scenario, right? In order to plan effectively, we need a pretty good idea of what people's decision is. But in order for them to make their final decision, they need some details on what the plan looks like. And so what we're going to do is ask those parents to make the best decision they can with the information they have. Then we can do our planning, much like you're talking about, Kevin, of, hey, all right, we have a pretty good idea for what people are going to decide. Let's come up with a plan and what it looks like. And then we can share that plan with those families. And if they need to change their mind based on those details, they'll be able to do that at that time. So that's how we're approaching that.
But how can parents plan if they don't know the plan?
That's exactly what I just said, Susie. So it's a chicken egg, right? So the parents, I do think the majority of our parents, just based on the information I've been getting in emails and things, they know what they're going to plan. They're either comfortable sending them in person or they're comfortable keeping them home. But we have the group in the middle that they really want to see the details of what does the plan look like. And so what I would anticipate happening is most people, they know what they're going to do come November 2nd, and they can tell us what that is. We can then use that information to put specific plans in place. And then if they need to change their mind based on those plans, maybe it looks even safer than they thought it was going to be, and they change their mind and decide to send them in person. Maybe some people don't think we went far enough with the plans once they see the details and they decide they want to keep their kid virtual. They'll have the opportunity to change their mind at that point. I do not anticipate, based on the conversations I've had and the emails I've received, I'm doubting there's going to be a whole lot of change at that point, but we'll see what happens when it comes.
Given recent scientific findings suggesting that aerosolization is the main vehicle for the spread of COVID-19 infection and evidence that supports the importance of the use of both masks and social distancing to mitigate infection. Please explain the rationale for not making social distancing a foundational principle in planning for safe in-person instruction.
So the social distancing, I would say, is a foundational principle in planning. If it wasn't, we would just go ahead and pack kids into the classrooms, and we're not planning to do that. So social distancing is an important aspect of this. But what the experts have shared with us over and over and over again is that it was nowhere near as critical as the mandatory mask wearing. It's the mandatory mask wearing that is going to keep the virus from propagating. So I'm not exactly sure how to answer that, because I do think social distancing is important. I just don't think that it rises to the level of the mask wearing based on all the conversations we've had with the experts in this area.
With the increased stress and anxiety of teachers as evidenced by survey data and the restricted teaching needs during a pandemic, such as lack of movement of students and teachers and continuing to teach on screen, possibly continuing to teach on screen concurrently, do you believe students will learn better in that environment?
Thanks for the question, Kimberly. I think it remains to be determined. I think our attitudes at how we approach things have a great impact on our students. And I think that if we approach it with an attitude of making it the best that we can, that we probably will have a good impact on students. I've received some concerns from parents that have said their teachers are bringing these things up in class and complaining about how terrible this is going to be and just how upset they are about it. And that's just, that kind of behavior isn't appropriate, right? And so that's going to impact those students. I think it's important that we as adults do set a model for our students, and that we absolutely can disagree and have challenging conversations and try to come up with good solutions between adults. But once we go a given direction, we need to step up and do what's best for our students. And so I do believe that we can have a very positive learning environment. We are all under a tremendous amount of stress, probably more stress than most of us have experienced in our lifetime. And we're going to have that one way or the other. I do understand that that there's a difference between teaching in person and teaching virtually. But I also think the stress that we're feeling when we go in person may be somewhat similar to the stress that many of our students are feeling by not being in person, for instance. So I'm not sure that it's that easily quantified, but I do think it's something that we need to just be really cognizant of, is how we're approaching it with those students to try to make it as successful as possible.
Some teachers are at risk and will not feel comfortable cleaning up to 7 times a day, and no teachers will have the time to clean after each class. Can students be asked to clean their own area at the end of each class, and where will these supplies come from?
So thanks, Eileen. This is very similar to one of the answers I had earlier, so I'll just kind of clarify. We do have a lot of supplies. I don't have the numbers off the top of my head, but I know we have pallets and pallets of sanitizer and wipes and masks and all these other things that our operations team has done a great job obtaining and collecting and storing. So we have a lot of cleaning supplies available to us as we move into this period. The question, I think you said something about 7 times a day and things like that. I think it kind of ties to the other answers I had earlier, where we do need to try to limit a lot of these transitions. I think it was Kevin had asked a question about that, perhaps. And so it is important for us to limit those transitions in terms of figuring out what it looks like to clean in between groups of students, for instance, is a big deal, and 7 transitions will be difficult to manage. I do think it's not unreasonable, and it has been happening since the beginning of education, for students to take a part in their own environment. And so if it's age appropriate for students to say, hey, students, grab a wipe and wipe down your desk, I don't see any problem with that. I do think they need to be age appropriate things, and we need to take into consideration the specific students we're dealing with. But again, I think that's something that individual schools can deal with and figure out what's best in their environment. But it is something I'm feeling good about the supplies we have. It's something we'll continue to monitor to make sure we have enough supplies But as we are right now, we have pallets and pallets of supplies, and I'm feeling pretty good about where we are.
Thank you.
I want to go back. I'm sorry, whoever I interrupted. I want to go back. When will parents choose? I think you said next week.
No, we're this week. We finally got it figured out this morning. We had to work with Infinite Campus to figure out the solution for how people would choose. They developed a custom solution for us because more and more districts are asking for this functionality. So if it hasn't gone, it may have even gone out tonight. I'm not sure. It will probably be going out tomorrow, and we'll be asking the parents to respond as quickly as they can, just so we can start to get a feel for where they're landing on that.
Excuse me, Dr. Judy. I want to ask about transportation and the buses. Are there going to be monitors on the buses, or are we going to get more buses? How is that going to be handled?
Yeah, good question, Holly. So there's a variety of answers. One, we're going to continue to encourage people to walk and ride to school. We are a very small community, and the vast majority of our students can get to school on their own, either through biking or walking, walking school buses, things like that. Those are great solutions. Anytime, they're especially great solutions during a pandemic, because we do need to limit the number of students that we have on our buses. Our transportation department has been working hard to come up with plans of what it looks like for kids on buses. They've been working with experts in that area, as well as their colleagues throughout Metro Atlanta, to figure out how do you load kids on the bus, how do you unload kids on the bus, how do you do all of these things in a safe manner. So they do have plans. They'll be sharing them as people have to start deciding if they are going to use bus transportation or not. But like I said, I am going to really encourage people use bus transportation only if you absolutely have to, which some of our folks do, and it'll be there for them and available. But if it's not absolutely required, it would be a good idea to use another mechanism for getting to and from school. And that will just help us all a lot. Any other questions? All right, do we want to jump to your closing thoughts?
Okay. Well, we have received many questions from teachers across the district, and the questions selected tonight represent the best possible. I know we're leaving out things that are still important to people, but we want to go ahead and start our closing. We've been inundated with data, figures, and stories, and due to the politicization of this pandemic, it's difficult to discern which sources are the most trustworthy. So we want to end with our truths.
Dr. Duty, in 2 different occasions tonight, you said that you were glad that certain topics came up. The topic of race and the topic of caring for our custodial staff. You said oftentimes people only bring up these topics when it serves them as an individual. I like to think that the CSD staff wants to take care of everyone at all times, and I would hope that you think that as well. You alluded that these topics were brought up by our staff in a possible self-serving manner, and I'm going to believe that you do not believe our staff would do that. In addition, many of your answers tonight included, this is something we are working on. We are looking into this. The schools are working on that. Schools are developing that. Schools can figure that out in their environment. You can see that the uncertainty in some of the answers lead many of our school staff to question the readiness of our district to return to school.
And again, we just want to end with our truths. We are solidly in a pandemic without a reliable vaccine for many months. In DeKalb alone, we have had 2,100 hospitalized over the last 8 months for the virus and have currently lost nearly 400 lives. We know the lives lost in our small Decatur community. There are lasting and unclear long-term health impacts from COVID-19 that we are just beginning to understand. Our African-American community is twice as likely to become ill and die from the effects of COVID-19. Effective mask use, social distancing of 6 feet or greater, and groups smaller than 10 outside are mostly safe when done correctly. We are asked to quarantine if we have been exposed to an infected person for over 15 minutes. We have vulnerable staff and children. The majority of teachers are weighing leaving their jobs or risking their or their family's health. Online learning is not the same quality of learning that we're accustomed to providing our students, but nor can in-person pandemic learning be the same quality of learning that we are accustomed to providing for our students.
But not all our truths are negative. We also have a solid, well thought out virtual plan that students can access safely. We are a resilient, nimble, intelligent community who work together to find solutions for students who can't work from home. We have the ability to safely provide in-person support for our students who are truly struggling with online learning. We can find options that both protect our staff, parents, children, and community, and provide an education, even during a pandemic that surpassed most schools in Georgia.
Dr. Duty, we, your teachers, your caregivers, your staff, and your Teacher Advisory Council, we would like for you to reconsider the timeline of return. We would meet you at the table to support a quick return for our most vulnerable students while also working on a safe plan for in-person teaching when your staff has more time to prepare and the district truly can be confident of everyone's safety. We appreciate your time tonight.
Thank you all. I've shared many times, I understand the fear and the concerns. I appreciate you all sharing your truth. I share many of your concerns myself. I understand how difficult it is to wrap our heads around the situation we find ourselves in. I also understand why the majority of the questions tonight had kind of an us versus them feel, even though I hope we can recognize we're all into this together, just like you guys were saying. So I look forward to continuing looking at these decisions and making the best decisions we can with the information that's available to us. So I appreciate the willingness to be a part of that, and I look forward to those continuing conversations. I do want to leave you with an example of just an example of how difficult risks are for us to comprehend. So if we were able to pull together a group of 25 people in DeKalb County, and on a scale of 0 to 100%, what do you think the probability would be that at least one of those people is infected with COVID? So I'll give you a second. You don't need to answer. Rhetorical question if you want to think of it that way. But so imagine 25 people, we pull them together in DeKalb County. What's the probability at least one of them has COVID? And right now, the answer to that question is less than half of a percent. And so that alone is not an indication it's safe for us to return, but all of these data taken collectively is what we need to be looking at and looking at objectively. And they provide very strong evidence that it's safe for us to do so. However, I also understand that there are different ways of interpreting these data, and there is a desire for a very objective standard. I can understand why places like DeKalb County have said that when it hits 100 cases, that's when it switches. I don't think that is as responsible as what we're doing, where we are looking at a totality of information, not just a single metric. But it is something that I am willing to continue looking at and trying to decide what we do there. So I just very much appreciate all the teachers on the Teacher Advisory Council. You guys have done an admirable job representing your colleagues during these incredibly difficult times. I appreciate all of you who tuned in for this town hall or who are watching the recording. And I just really encourage you to continue sharing your ideas and your feedback. We review every bit of it that comes in. It really helps us make the best decisions we possibly can. None of our plans have been set in stone, and this current plan is no different. And so I look forward to these continued conversations as we move forward. So we'll continue adapting to the environment we found ourselves in, and this is just going to be a year for the record books. So I just really wish you all the best, and thank you all for your time tonight.